it's probably going to be quite some time until we stop seeing many of these news-related articles about the pandemic. So, in the latest, Reuters talks about U.S. record cases as election looms, and so we're going to hear some of the information, of course, that is being, I guess, passed on through the news media, and then we're going to take a look at the facts. So we're not making any assumptions here. We're just going to listen to the video, and then we're going to look at the facts, and then it's up to you to decide what's going on and why, of course, we're continually seeing many of these sort of news-related articles, and they will continue until well past the election, regardless of, I shouldn't say regardless, but I would say if Trump wins, we're probably going to continue to see more of these sort of videos.
A record surge of coronavirus cases in the United States is pushing hospitals to the brink of capacity and killing up to 1,000 people a day, according to the latest figures as of Friday.
Things are very, very bad in the United States right now. We are having some of the largest outbreaks that we've had during the entire pandemic.
And so it's always easy to find some sort of a professional to sound the alarm, basically.
Ashish Jha, dean of the Brown University School of Public Health, says the current spike is different than in the spring.
It was localized to a few areas. It was localized in the Northeast. There were parts of the Midwest, but it wasn't the whole nation. This surge is really happening in every region of the country, almost every single state. And we, of course, know so much more, and we saw this coming. We knew it was coming, and we still have not adequately prepared for it.
And we're going to take a look at the numbers to see if what they're saying, of course, is correct. We're going to look at the data, and of course, they're going to tie all this in to the president.
The United States broke its single-day record for new coronavirus infections on Thursday, reporting over 91,000 new cases.
And it's important to understand when you hear the news media or any sort of a politician refer to cases, what they're really referring to is people who've tested positive via a PCR swab like they just showed. It's either done in the back of the throat or, of course, deep back in the nasal passages. And that's what they're typically referring to. The spikes in cases are typically, I should say, are exclusively related to not hospitalizations, but to people who have been swabbed and test positive.
As 21
And it doesn't mean that they're symptomatic.
states reported their highest daily number of hospitalized COVID-19 patients since the pandemic started, according to a Reuters tally of public data. U.S. President Donald Trump has repeatedly downplayed the virus, saying for weeks that the country is rounding the turn. The president's oldest son also tried to minimize the crisis, telling Fox News on Thursday deaths have dwindled to, quote, almost nothing. Speaking on the same day, more than 1,000 people died of COVID-19 in the U.S. This as the coronavirus sweeps states that will be crucial to next week's presidential election, such as Ohio, Michigan, North Carolina, Pennsylvania, and Wisconsin. The coronavirus, which has killed roughly 229,000 people in the United States and hammered the economy, has dominated the final days of the campaign. Since overcoming his own COVID-19 infection, Trump has maintained a frenetic pace, holding up to 3 rallies a day with thousands of attendees, despite concerns the events could spread the virus.
Super spreaders. Everything's a super spreader event unless you're rioting and looting or protesting the death of some criminal. Then it's not a super spreader event. Then it's a much needed event. With that aside, depending upon what website you utilize, whether it's the World Health Organization or the CDC or other hospital, you use like Johns Hopkins. But according to HHS, right, Health and Hospital, there are currently 50,500 patients currently in occupying a hospital bed who have tested positive. Now, let's just automatically assume that every single one of these individuals is in the hospital and brought into the hospital because of the current virus. We know that that is not the case because even from my own experience, I've had patients that have tested positive and have not had any sort of respiratory symptoms, and they just go about their way as soon as they're discharged. And then of course we've seen some people who come into the hospital and could be end of life, and that person tests positive for the virus. But with that said, let's just take the high end. Depending upon what you look at, it's between around 47,000 and the current estimate of 50,000. So we'll just go with the highest estimate, right? So in terms of the number of patients who are occupying a bed, it's also important to say, well, how many beds are there in the country? That is a good question. So we'll take a look at according to AHA.org, as you can see here, there are currently 924,000 beds, right? There are currently a total of 924,000 beds in the United hospital beds, staffed hospital beds in the United States. So that represents about 5%, right? A little more than 5%, 5.4% out of all the patients in the hospital, right? Currently, out of all the patients in the hospital, about 5% of them are related to the pandemic, right? Now, there will continue to be news articles about this, but it's also important to look at there's more data, right? So this is as of the 24th on the CDC website, right? So as you can see, in terms of hospitalizations and laboratory PCRs, as you can see, this is the National Surveillance Indicator tracking SARS-CoV virus circulation, right? So it's looking at hospitalization. This is what I'm looking at right here. Hospitalizations, and that's that gray one right here, right? So as you can see, the hospitalizations are heading down, right? And if this was a stock chart, this is basically making lower lows, right? We're making lower lows, showing that in terms of individuals who are needing to be hospitalized, it is continually decreasing. So even though you will hear news-related articles and sensationalized misrepresentations of the facts, when you actually stop and take a few minutes just to look at the data shows quite the opposite. Even when we'll go a little further down, we'll look at viral surveillance. As you can see here, the numbers are very low, actually almost at their lowest. So we hear news-related articles of COVID cases are out of control and they're spiking. But when you actually look at those who are actually infected, it's almost non-existent. Outpatient and emergency illness. This is actually quite important because within the data, right? When you look at the data, we'll take a look at some other data in a second. When you actually look at the data of those who are represented here, right? So a percentage of visits for influenza-like illnesses, right? So a lot of the influenza-like illnesses are also being added into the data for COVID. Is very important. When you look at, for example, when you look at the Council of State and Territorial Epidemiologists, so how people classify the virus, or how doctors are classifying whether or not someone has the virus, is based off of certain symptoms. And you can look at it here where they only have to meet certain amounts of the criteria, which is like, does the person have a fever? Does the person have a cough? Do they have, or is it acute respiratory distress? Or do they have ammonia-like symptoms? And if the person tests positive for the virus, then that is what they will put down as the person's cause of death, right? So it could be, there's numerous, and it's not all of them. It's not like you have to meet all of this criteria. It's actually, you only have to meet, it's like this and or sort of a scenario. We'll look at laboratory criteria, whether the person tested positive or not, or whether the person came into close contact with someone who was confirmed or probable disease, right? Or if there's if they're clinically compatible illness, right? So if the illness kind of looks alike, and of course the flu mimics very much what COVID looks like, which is why you're seeing the disappearance, right? The disappearance of the flu, especially around the country, around the globe. There have been numerous incidents of, well, people are asking across the globe, where did the flu go, right? Because there are no flu cases. There are currently 98% non-existent, right? And we get the flu, our flu season is late. So when you look out into the globe, and the World Health Organization is saying, well, a lot of these other parts of the country where they should be seeing hundreds and thousands of cases and reporting basically thousands of cases a day in terms of respiratory illness, they're seeing all of these respiratory illness diseases disappear, and the only disease that, of course, that is being I guess reported is, of course, COVID. It's one of the biggest viruses. It's the only virus, I should say, that is currently being reported in terms of respiratory infections. With that aside, in terms of hospitalizations based on age, as you can see, is very small. The only people that are really experiencing higher levels are typically even older people, right? Looking at the looking at the influenza season during 2019 and 20, and then looking down here is another good graph. Here we go. So in terms of weekly COVID associated hospitalization rates based by age, right? And so you can see the ones who are typically most susceptible, which would be like people who are 65 and over, which is right here, right? So even those who are most vulnerable to the virus is literally on a downtrend. So even though you'll continue to hear of cases and rising cases, when you actually take a look at the data, you see quite the opposite. So don't believe everything you hear.